Coronavirus is creeping across the African continent, infecting hundreds of people in at least 30 countries, including Burkina Faso, Cameroon, Ethiopia, Nigeria, Senegal, and South Africa, which currently has the most cases in sub-Saharan Africa. And although overall the Africa region currently has the lowest number of cases in the world, the head of the World Health Organization did not mince words when it came to how his home continent would fare if the virus is allowed to go unchecked.
We should do all we can to cut it from the bud, expecting that the worst could happen, because we have seen how the virus really speeds up and accelerates in other continents or countries. So that's our advice. And I think Africa should wake up. My continent should wake up.
Health officials say they're especially concerned about the health issues that are all too prevalent in some parts of the continent.
But we have not seen the way this virus will behave in other vulnerable populations. We have not seen how this virus will behave if and when we see in vulnerable populations of high prevalence of HIV, for example, or malnutrition children, for example. And that's what we need to prepare for.
South Africa has 150 confirmed coronavirus cases so far. The rising number has prompted President Cyril Ramaphosa to announce tough measures to try to slow the virus's spread, like a travel ban from high-risk countries, school closures, and a ban of gatherings of more than 100 people. South Africa also happens to have the world's highest burden of HIV.
Now, and I think there is not really any specific information yet available on how this disease affects HIV-infected individuals. But if we think about what we know from other respiratory viruses, such as influenza, and how they present in HIV-infected people, we do know that HIV-infected people, particularly those not on treatment, are at risk of more severe illness.
One grim reality experts say Africa must brace itself for. This is going to be a tough ride. Anita, Powell, VOA News, Johannesburg.